the Canadian Diabetes Association presents Angie's story, from diabetes diagnosis to building a diabetes care team. Know your team, stay connected, prepare for your diabetes care, and live well. Angie is a 48-year-old mother of 3 who works full-time at a call center. Recently, Angie saw a post about diabetes screening at her local pharmacy. When Angie asked how she could be screened for diabetes, her pharmacist asked her to complete an online CanRisk diabetes risk assessment. The next day, Angie brought a printout of the diabetes risk assessment report indicating that she was at high risk for diabetes. Her pharmacist sent the results of the assessment to her family doctor and encouraged her to make an appointment to see her doctor soon. To help Angie before seeing her doctor, the pharmacist gave her information on diabetes risk factors as well as prediabetes. Angie made an appointment and went to see Dr. Nelson, her family doctor, who reviewed the risk assessment report and asked her to have an A1C blood test in the lab right away. The A1C result came back indicating that Angie had type 2 diabetes. After a second A1C to confirm, Angie's name was added to a registry. Dr. Nelson uses this registry to keep track of all her patients who have diabetes. Angie asked, "Dr. Nelson, what do I do now?" Dr. Nelson worked with her to determine specific goals around her nutrition, weight, and activity. She was also given a prescription for 2 different medications, one to lower her blood glucose and the other to control her blood pressure, which was found to be high during her last 2 visits. Finally, Angie is encouraged to make a diabetes-focused follow-up visit with Dr. Nelson. Angie returned to the pharmacy to have her prescriptions filled. Angie learned even more from the pharmacist about how these medications work to help her with her diabetes, and she was reminded of the benefits versus potential side effects of each of the medications. Angie's pharmacist has extra training in diabetes and is a certified diabetes educator. It was helpful for Angie to talk about these new medications and how they work, to keep her blood sugar and blood pressure in the right range. Angie's pharmacist let her know that there are many community resources which will form a diabetes team to help her learn about diabetes and how to take care of herself so that she can live well. Her pharmacist told her that she could go to the local diabetes education program around the corner from her work, and that her doctor would send a referral for her to become part of that program. The local diabetes education program includes a team of diabetes educators who are nurses, dietitians, and physical activity experts. Angie was very relieved to be referred to this program because she knew that the team would be able to help her modify her diet based on her food preferences and her allergies. The team, including the diabetes educators, pharmacist, and family doctor, all work with Angie and support her as she learns the best way to manage her diabetes. This teamwork will help prevent the progression of the disease and complications that can happen if diabetes is not well managed. As Angie got to know her team, she realized that there are other healthcare providers and specialists, such as social workers, foot care experts, and optometrists, who can be called to provide support for her. Angie wrote down the names and contact information for all of these people on a list, and found some other helpful tools that she decided to use to track her goals and keep notes from every visit she had with a member of her diabetes healthcare team. When you live with diabetes, get to know your team. They work together and will support your individual needs throughout your life. Know your team, stay connected, and live well. Find lots of helpful tools to help you stay on track here. Me, my health, and my diabetes team. Now you know Angie's story. What about you? What would be helpful for you to manage your diabetes? Your action plan tools? Make an appointment with your doctor or at a local diabetes education program. Learn more about diabetes, risk factors for diabetes, and public programs at diabetes.ca or call 1-800-BANTEAM. Become a member of the Canadian Diabetes Association.